All set.
We're wiring up with a hidden camera, heading inside this pharmacy to buy a narcotic. A drug kept behind the counter for good reason.
Bottle of Tylenol.
The pharmacist is supposed to warn us about risks before handing it over. So, will she?
$6.29 is your total, please.
In a matter of seconds, we're off. Drugs in hand, no warning. A fail in the biggest pharmacy test of its kind. This week, Marketplace investigates pharmacy errors coast to coast.
I went to emergency twice because I thought I was having a heart attack.
Disturbing secrets from behind the counter.
So you know pharmacists who've had patients who've died because of a medication error?
Yeah, like say it's everybody's biggest fear that it'll ever happen to them.
Why aren't pharmacists doing a better job of protecting people?
We reveal an industry dispensing danger. We're in North Sydney, Nova Scotia, investigating a medication mistake that almost killed Vince Garnier's mother. Not long ago, he got an urgent call. His father.
He started to cry on the phone. He said, "The ambulance is here. I've got to take your mother down to the hospital again. It's bad. I don't know what's going to happen."
His mother, Sharon, had just started taking a drug called Avalox to treat pneumonia. But less than 24 hours later, alarming symptoms.
Lightheadedness, dizziness, confusion, headaches, and to the point that she almost fainted in the house a couple of times.
She's rushed to hospital. Over the next 2 weeks, 3 more trips, each time her heartbeat wildly erratic. Finally, a doctor solves the mystery.
It was kind of a eureka moment. I found the problem. My father said, "What?" And he said, "She should never have been issued Avalox."
Turns out that drug was interacting with heart medication Sharon had been taking for years. All her prescriptions were filled at this Walmart pharmacy.
I look at the pharmacist as the last line of defense. It's their job to check the interactions. The pharmacist didn't do that. Whether or not the doctor should have done that, that's for someone else to say. My concern is that the pharmacy failed in my mother's case on 2 occasions. And this is where the system needs to be fixed.
We want to know how common pharmacy errors are. So we head to the Canadian Pharmacists Association.
Hi, Erica Johnson.
Great to meet you, Erica.
Nice
Jane
to meet
Farnham.
you. How many medication mistakes are happening in Canada every year in pharmacies?
At this juncture, there's no national reporting system, so we do not currently have good, reliable data on those incidents.
So we have no idea if a few medication mistakes are happening or a lot?
We don't have any reliable information at this juncture to be able to comment.
Yep, incredibly, no one knows. There's no mandatory requirement in Canada that pharmacists report the errors they make to an independent body. But even conservative estimates place the number at 50,000 a year.
You good to go?
What could be going on behind pharmacy counters? We wire up a secret shopper to see whether pharmacists will catch a potentially dangerous drug interaction with a popular medication.
Heading into London drugs.
In Vancouver, we head into 5 drugstores to ask for Palafer, a heavy-duty iron pill. It's kept behind the counter for good reason. Among other things, it can make antibiotics less effective.
Can I get a bottle of Palafer?
According to their own guidelines, pharmacists are supposed to ask what other drugs you might be on. If asked, our shopper will say she's taking a common antibiotic.
Have you used the iron before?
No, I have not.
Things start off well at this London Drugs.
It's better absorbed on an empty stomach if you tolerate it. If you get too much nausea, then take it with food.
But this pharmacist doesn't ask about other medications she might be taking.
You can either pay at the cash or upfront, either.
At Rexall, Shoppers Drug Mart, and Safeway, pharmacy staff hand over behind-the-counter drugs. no one gives any advice at all. More shocking, not one Vancouver pharmacist at any of the 5 drugstores catches the potentially dangerous interaction between Palafer and antibiotics.
Thank you.
Pharmacists are making mistakes, but we need to ask, why are they making those mistakes? Are the staffing levels too low? Are they working too many hours?
We want answers too, so go looking for insiders, pharmacists willing to take us behind the counter where mistakes can happen. We talk to many, and 2 agree to come on camera if we conceal their identities. They fear reprisals. Both have worked for major chains. This insider says the public needs to know what's going on.
I think they see the white lab coats and the staff back there that they've seen for years, and I think they just think we're the health professionals that we are. And I don't think they understand how their safety could be compromised by all the pressures we're under.
Pressure, they say, to fill more prescriptions than ever before.
Running a pharmacy today, it's like racing a race car or any race. You know, they're running at the ragged edge of control. Pharmacies like that too. We're going as fast as we can while still being in control.
Are you in danger of spinning out of control?
I think we're coming pretty close some days.
Pharmacists fill about 600 million prescriptions in Canada every year. Chain stores, grocery stores, big box stores, big companies, all vying for your prescription dollar. It's a business dominated not by small independents anymore, but by big corporations.
It used to be, when I started this many years ago, there was a lot of pharmacists in the management of the company. And I think we're getting to a point now where the whole industry is being run by non-pharmacists. That's not good for the industry.
Who's it good for?
Well, it's good for the companies that are making the profits. Pharmacy, providing health care, patient care, these are all jeopardized.
Insiders from several drugstores tell us some corporations that now control the pharmacy industry impose metrics or prescription targets that must be met.
Prescriptions per day, prescriptions per hour, number of labor hours per prescription, even ratios of technicians versus pharmacists. If you're using too many pharmacists to technicians, then you're not being very efficient.
They'll give you a number to hit, and if you don't hit your number, then you haven't hit your metric. When you haven't hit your metric, now they're going to come in and, quote, help you.
Could the drive for profits be compromising safety? We try for weeks to interview the business association that represents most of the major drugstores. They say our test findings are concerning, but won't talk on camera. So our producer pays them a visit.
Hello?
Hi.
Yeah.
We're from CBC Marketplace. We'd really like to talk about the concerns we're hearing from pharmacists.
Are you taping this now?
Yes, we are.
Yeah. So we're not interested in commenting. We've already given you our comments, so that's as much as we can do.
Will you not say any more
Can't
than
say
this?
any more. Thank you.
In North Sydney, Nova Scotia, Vince Garnier's father heads back to Walmart to find out why the pharmacist there didn't flag a potentially deadly drug interaction. She had a surprising confession.
The pharmacist said to my father, it was me. I was the pharmacist on that day. And then she added to my father, I was busy that day. We had several other prescriptions I had to fill, and I should have called the family doctor because I saw the red flags, quote unquote, red flags, but I forgot to call the doctor.
So busy you slip up? It's a fear our insiders know only too well.
Have you ever ended a shift and thought, I hope I made the right call?
Absolutely. Sure. You know, and it's not just one right call. I suppose there's 2 or 3 that stand out in your mind at the end of the day, but you just hope that you've done everything right and you didn't hurt anybody.
Have you ever said, gee, I hope I didn't make a mistake?
Every day. As far as I know, I've never had a patient pass. I've had pharmacists that I know that have.
So you know pharmacists who've had patients who've died because of a medication error?
Yeah, like say it's everybody's biggest fear that it'll ever happen to them.
Could pharmacists be so busy they're cutting corners wherever they can? To find out, we're taking our test nationwide, sending shoppers out to 9 cities across the country, 50 pharmacies in all. And this time, we up the stakes. Will pharmacists pass the test when we ask for a narcotic?
Hi there. Can I get a small bottle of Tylenol 1?
Did your pharmacist make a mistake? Share your story and read what others are saying on Facebook and Twitter. We're investigating pharmacy errors. In Baltimore, Ontario, Sandra Kazook considers herself something of an expert. By her count, she's been a victim of 4. The last one, by far the worst. Last February, Kazook's pharmacist cut a dose of her anti-anxiety medication in half by mistake.
I went to emergency twice because I thought I was having a heart attack.
What did it feel like?
It just feels like thunder in your chest, and you can't control it.
Over the next 6 weeks, Kazook is overwhelmed by feelings of anxiety and paranoia. She has severe hallucinations, can't walk straight. Her partner convinces her to get help.
Gary was like, Sandra, you need to see a doctor. There's something wrong. And then my intuition told me, go to the pharmacist first. He asked me to sit down, and he took the pills into his back office, and he looked at them, and he took all my records. He pulled some records out of a drawer, and he looked at it, and he said, I'm very sorry, we've made a terrible mistake. Give me a kiss, hon.
Kazook says a year later, her health still hasn't returned to normal. Neither has her faith in the system.
How can he mistake it by 3-4 people like that? You think they've done it right, and they've done it wrong.
So, how often do pharmacists get it wrong, ignore their own guidelines? Now, we send secret shoppers out to 9 cities across the country, 50 pharmacies in all. This time, we pick a behind-the-counter drug that contains a narcotic, Tylenol with codeine. In many countries, you need a prescription to buy it. Take it for even a few days, and it can be addictive.
Hi.
In Saskatchewan, you have to show your health card to buy a bottle.
Have your health card?
And they limit how much you can buy. But all pharmacists across the country are supposed to ask key questions, provide counseling before handing over behind-the-counter drugs. Jane Farnham of the Canadian Pharmacists Association.
Well, pharmacists obviously need to understand as much as possible about the patient's condition. They need to understand what other medications they may be taking.
Should they ask whether or not that person is on anything else that might counterindicate?
Yes, it's important for the pharmacist, as best as possible, to have a comprehensive understanding of what patients are taking before making recommendations.
Here we go.
Our cross-country test underway. In Ottawa, this Loblaws pharmacy is off to a good start.
With this medication, just take milligrams of codeine in it. Just try to avoid driving or drinking alcohol because it can cause drowsiness, and it can be a bit constipating as well, so just increase your fluid intake.
And there's some good advice at other pharmacies too.
Watch the drowsiness with it. You should probably not be driving your car. Let's start with 1 tablet to see how it is. If not, you can take 2 at once.
Not more than a couple of days in a row. If you need more than that, you should go to see a doctor.
Now watch what happens in other drugstores. Less than 10 seconds and the transaction's done.
You want a bag?
No, that's fine.
Right across the country, bottle after bottle of Tylenol with codeine sold. No warnings, no advice. All told, 27 out of 50 pharmacies fail the test.
$9.19. 27 out of 50 gave no counseling whatsoever. More than half.
And in the other situations, the pharmacist provided counseling.
In more than half the cases, there was no counseling whatsoever for a behind-the-counter drug, in most cases, a narcotic.
We continue to strive to provide tools, to provide education, to do everything within our power.
But is that satisfactory?
There are mechanisms in place if a patient or a consumer receives an unsatisfactory level of service.
But our insiders say when time gets tight, patient counseling does get squeezed.
I can save time in counseling, where before I might have spent 5 minutes talking to somebody about their new inhaler. Now maybe I can do it in 2 or 3 minutes by talking a little faster and perhaps not being quite as thorough.
Not being thorough can have serious consequences. We told our secret shoppers to say, if asked, they're on a popular anti-anxiety medication. Pharmacists should warn them that codeine could increase the drug's side effects. But not a single pharmacist warns our shoppers about the potential interaction.
Of the 50 tests our shoppers did, not one pharmacist warned them about a potentially dangerous interaction. What do you think of that?
We have set in regulation and in standards of practice the highest quality standards available
Are those
across
standards
the country.
being met? On a scale of 1 to 10, what rating would you give pharmacists in terms of how well they did, 10 being good?
Sorry, can I just pause for a moment on that one? Okay. Pharmacists continue to endeavor to provide high quality patient care and patient outcomes. I'm not going to comment on specific isolated incidents.
But these are 50 incidents. It's not like we went to one pharmacy in one city. We went to 50 and this was the result.
I absolutely don't believe that to be the norm. It's not been my personal experience.
So this was a fluke?
I can't comment on specific isolated incidents. I believe that not to be the norm.
Our insiders say the new norm, not enough time. Pharmacists are being asked to perform more and more services. They tell us they feel pressured to push things like flu shots.
No.
And offer other services that make money, like med checks. In Ontario, anyone on more than 3 medications is eligible, and pharmacies can bill the government as much as $60. It can be useful when the right patient gets one. But our insiders say a lack of time means that doesn't always happen.
If you know you have a target you need to hit, well, you're going to find that pretty healthy, 55-year-old who's on 3 or 4 drugs and easy to communicate with, and you're going to do a med check with that person.
What's wrong with that?
Well, what's wrong with that is, the next customer who's 84 years old and on 11 drugs and doesn't understand what you're saying and will be a slow communicator really needs that med check. But you're working against the clock and you only have so much time. You've got to do one. Which one are you going to do?
This pharmacist thinks there needs to be a better balance between profits and safety.
There's not evil people in the corporation, but they are beholden to the shareholder. And when 50% of your business is driven through the pharmacy, you have to do something.
When we come back,
They hurt my mother.
Vince Garnier takes on Walmart.
I can't trust Walmart Pharmacy. I can't.
Our prescription for avoiding pharmacy errors. Get our tips at cbc.ca/marketplace. We're in North Sydney, Nova Scotia, investigating pharmacy errors. Vince Garnier's helping his mom fight back after a Walmart pharmacist dispensed a drug that caused a dangerous interaction with her other meds. His family wants Walmart to apologize, tell them what they've done to make sure it doesn't happen again. And they think Walmart should pay the ambulance costs.
The pharmacy manager said, no, we're not paying that bill. Imagine, it's Walmart, $631. They hurt my mother, and they didn't want to pay the $631.
What does Walmart do? Send a legal letter saying our pharmacist filled the prescription correctly as prescribed, and that the pharmacist counseled on the critical risks.
That is just blatantly untrue. And to me, it's another example of a corporation hiding. They're hiding from their responsibility. They're hiding from their accountability. And that tells me even more that I can't trust Walmart Pharmacy. I can't.
Garnier complained to the Nova Scotia College of Pharmacists. Deputy Registrar Bev Zwicker says they're investigating.
It's very upsetting. And as a regulator, of course, when we hear about something like that, we immediately send our inspector up to take a look to see what is the practice at that pharmacy.
Ironically, this province, Nova Scotia, is the only place in Canada that has a mandatory error tracking program. Pharmacy staff here are supposed to report. It's anonymous to encourage compliance. In 3 years, they've recorded 75,000 errors or near misses.
Pharmacists can look at the error and say, what do we need to do to make sure that doesn't happen again?
After learning about our investigation, some drugstores and the group that represents most of them say they're concerned and take reports of errors seriously. Walmart and Shoppers are asking pharmacists to review standards of practice. That may be, but how about a mandatory national tracking system? We asked Jane Farnham of the Canadian Pharmacists Association.
We have, to my knowledge and to my belief, one of the safest medication systems in the world.
But it's your belief. We don't know because we have no way of knowing.
Our regulatory bodies across the country, their sole mandate is the protection of the public.
This pharmacist says the public needs better protection. Fellow pharmacists need to push back.
I think overall pharmacists need to stand up and say, metrics be damned. I'm not going to do it.
Vince Garnier also hopes pharmacists fight the pressures to deliver more profits.
This is not about productivity. This is about people's lives. But I would ask the individual pharmacist to do one thing, and that is treat every customer as if it was their mother or their father, and take the time that they need to take to make sure that the prescription is right.
Before we go, some ways you can protect yourself. Keep a list of your prescriptions and make sure your pharmacist keeps track too. Check the dose, drug, and name on the bottle to make sure they're correct. But double check to see if the pills inside match. And whatever you do, don't be afraid to ask questions, especially about possible interactions. We've got plenty more tips on our website. Next week on Marketplace, we'll show you ways you can help protect your money. See you then.